Hello, I'm Victoria Bennett and I'm a student physical therapist assistant at Jeff State, and today I'm going to be talking to you about hepatitis B. Hepatitis is the inflammation of the liver, and there are many strains that have different characteristics and pathological processes. Today we're going to be talking about hepatitis B. Hepatitis B is a virus that can be acquired through transcutaneous and transmucosal means. Some typical causes are puncturing one's skin with a previously infected needle, sexual contact with a hepatitis B positive individual, and transmission from a mother to her child during pregnancy. Once the virus has been contracted, the immune response begins. The natural killer cells are important to the control of the infection in the liver because they will both directly attack the infected cells and secrete antiviral cytokines like interferons to assist in the destruction of the virus. Then the antigen-specific T cells will clear and remove the virus. Antibodies will aid in containing the infection and with future prevention. If the individual's immune system is sufficient, then the attack will most likely eliminate the infection and not become chronic. Studies have shown that hepatitis B will interfere with the natural killer cells by altering their inhibitory and activation receptors, compromising the protection of the liver cells and leading to increased virus production and higher risk of severe complications of hepatitis B infection. There are two different classifications of hepatitis B, acute and chronic. Acute hepatitis B generally has mild and generic symptoms, if any at all. These symptoms include light fever, decreased energy, tenderness in the abdomen over the liver region, jaundice, and possibly nausea and vomiting. Chronic hepatitis B has no symptoms initially, but as the damage manifests for at least 6 months, it presents with progressively more muscle weakness and wasting, joint aches, swollen abdomen, dark urine, and decreased body weight. Any age can contract hepatitis B, but the likelihood of chronic infections is increased in young individuals. Only 2 to 6% of adults develop chronic hepatitis B infections, in comparison to children under the age of 5 at 30%, and infants who have about a 90% chance of chronic infection development. This is because infants' immune systems are not fully developed and therefore compromised. Medical treatment for hepatitis B is provided for chronic hepatitis patients that have high levels of hepatitis B DNA. Nucleotides, or NUCs, are administered to these patients, and the intention of the drug is to suppress the hepatitis B virus so that it can no longer replicate and damage the liver. This has been found to be very effective if infected individuals continue taking the medication. If a patient has already sustained liver damage, then they might have to be put on dialysis to help with blood filtration and decrease toxicity. The best treatment for this pathology is early prevention. Vaccinations are available for prevention of hepatitis B and have been shown to decrease the prevalence of the disease worldwide. In a study conducted in Taiwan, a vaccination program was able to lower the amount of hepatitis B carriers from 20% to 1.6% by offering all newborns the vaccination. Another key component of prevention is the precautions of healthcare providers. All healthcare providers should be educated on hepatitis B and be trained on specific protocols for highly infectious diseases. The virus is 100 times more easily transmitted than HIV. So since therapists come into close contact with their patients, they need to be aware of the precautions to take. The most important actions a therapist or any healthcare provider can do to protect the safety of the patients and themselves is to get vaccinations and screenings, follow facilities' set protocols and standard precautions, wash their hands, and wear personal protective equipment. Some factors that will affect the physical therapy treatment plan, goals, and progression are joint pain, energy deficiencies, and nutritional deficiencies. Joint pain affects many individuals with hepatitis, and the occurrence of joint pain rises with age. Joint pain is present in 18% of children with hepatitis B and 45% of individuals over the age of 30 with hepatitis B. Rest and energy conservation is an important aspect of recovery for the hepatitis B patients, but the individual should be encouraged to stay as mobile as possible. There has to be a balance of rest to prevent excessive fatigue and activity, which will preserve a functional aerobic condition, strength, and mobility. Energy conservation tools are important to teach these patients. Weight bearing is an important aspect of exercises in order to address postural muscles and provide stress on the bones to promote bone growth. Since the patient is most likely experiencing decreased vitamin uptake and mineral uptake due to the decreased metabolic liver functions, bone growth needs to be promoted along with increased strength. Patient education should include informing the patient of the pathology and how it is transmitted, and also healthy lifestyle choices such as avoiding alcohol, smoking, IV drug use, practicing protected sex, receiving vaccinations, healthy diet and mild exercise, and liver cancer screenings for early detection. In conclusion, hepatitis B is a pathology that will often come in contact with physical therapy, either from impairment caused by the virus or simply treating a patient with hepatitis B. The advancement of hepatitis B treatment has come a long way, and with the help of vaccinations and education, there is hope that the virus will soon be a thing of the past. The end.